This short video is designed to quickly and effectively educate you on the new drug you have been prescribed, Coumadin, also known as warfarin. What is Coumadin? Coumadin is a drug that thins your blood by preventing you from forming clots. This drug is called an anticoagulant. Blood clots can be harmful if they get lodged in a vein or an artery, reducing or cutting off blood supply to vital organs, causing events such as a stroke, heart attack, pulmonary embolism, or a deep vein thrombosis. You are taking this medication because you are either at risk for forming a clot, or your body has already formed one and the Coumadin will prevent the clot from getting any bigger. What to expect when beginning to take Coumadin. When you first start taking Coumadin, your blood will need to be monitored by a healthcare provider. This blood test is called PT-INR. This test will measure how quickly your blood clots. This test will need to be conducted regularly as long as you are taking Coumadin. When you first begin taking this medication, your body will need time to adjust to the medication, so the dose of Coumadin may change day to day. There are certain drugs that can affect how Coumadin works. Be sure to tell your healthcare provider any drugs you are taking, even if you don't take them every day, and even if they aren't prescription drugs. For instance, if you take aspirin, ibuprofen, Advil, Aleve, or other over-the-counter pain or cold medications, these drugs can also act as blood thinners and would therefore interfere with the Coumadin effects. This could put you at increased risk of bleeding. Other drugs that can interfere with how the Coumadin works are antibiotics and topical analgesics such as Aspercreme, Bengay, and Icy Hot. There are certain herbal products that affect how Coumadin works. Inform your healthcare provider if you are using any herbal products, including teas. What we eat can affect Coumadin as well. Our bodies depend on vitamin K to form blood clots. Some foods contain a high amount of vitamin K, such as green leafy vegetables, and this can interfere with the effectiveness of Coumadin. Once you start your Coumadin regimen, you can eat these vegetables in small amounts, but be sure to keep the amount consistent day to day and week to week. The following foods are high in vitamin K: broccoli, cabbage, endive, mustard greens, spinach, Brussels sprouts, collards, kale, parsley, turnip greens, canola oil, soybean oil, avocado, and green onions. Cranberries and cranberry juice can also affect the way Coumadin works, so avoid anything with cranberries. Alcohol can thin your blood as well, so talk to your healthcare provider about your alcohol consumption prior to taking Coumadin. Also talk to your healthcare provider before you start any diet. What are the side effects of Coumadin? Since Coumadin is a blood thinner, you are at a higher risk of bleeding from activities such as brushing your teeth, shaving, flossing your teeth, trimming your nails, and using toothpicks. Be sure to inform your dentist and all of your healthcare providers that you are taking Coumadin. You should prevent injury by wearing shoes, indoor and out, that help prevent falls, such as non-skid shoes or slippers. Be very careful with scissors, knives, and other sharp objects. Avoid activities and sports that could cause injury. However, safe exercises are very good for your health. Talk to your healthcare provider about any new exercise regimen you would like to start. Call your healthcare provider immediately if any of the following occur: extremely heavy menstrual bleeding, red or brown urine, bowel movements that are red or black, bleeding from your nose, gums, or a cut that doesn't stop bleeding quickly, vomit that is brown or bright red, if you cough up something red, severe pain, for example, a bad headache or bad stomach ache, bruising that is unusual, a bad fall or a bump on the head, even if it wasn't a hard bump, dizziness, lightheadedness or weakness, difficulty breathing, vision changes, skin that appears yellow, any other unusual symptoms you are concerned about. If you experience any new adverse reactions, call your healthcare provider immediately. And do not hesitate to ask any questions pertaining to your Coumadin regimen.